Good morning, namaste, and welcome to Times Health Plus. I am Dr. Sneha Rathi. I am a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of physiotherapy and yoga and give the best results to my patients through them. So today we are going to discuss about a topic which is completely different from what we have been discussing all this while. So all this while we have been learning about different joints, how to tackle them, how to take care of them. Today we are going to discuss about one of the conditions, okay, which is affecting a lot of people these days, and how we need to tackle that kind of condition. We are going to discuss about that, and that is nothing but a condition known as fibromyalgia, okay, or a chronic pain condition, anything that causes chronic pain. Now first let's understand what does fibromyalgia or chronic pain mean. So when the pain occurs for a small period of time or after an injury, it is called as an acute pain, okay, or it is high in intensity, it's called as an acute pain. But when the pain becomes chronic, that is, it lasts for a long period of time, as in it lasts for more than 3 months, okay, then it is started to know as a chronic pain. Okay, so when the pain becomes chronic, it definitely indicates that there is an underlying cause which is not being corrected. Okay, so we need to find the underlying cause and start treating it regularly. Okay, that's very, very important whenever you are dealing with chronic pain. Okay, so the next thing about chronic pain is that whenever there is a small amount of pain, we tend to ignore it on a regular basis. Okay, it's very important to deal with the pain as and when it happens. So whenever you have some pain, try to deal with it, try to find out what is the cause of that pain and deal with it, so that it does not turn into a chronic kind of pain. Okay, so that's very, very important while dealing with chronic pain. Now let's understand what is fibromyalgia. So it is basically a psychosomatic condition. Now what does psychosomatic mean? Psychosomatic condition is nothing but when your psychological factors are leading to changes in your body. Okay, so psychological factors like stress, anxiety, depression can actually bring about lot of changes in your body. Okay, especially if you have noticed, whenever you are stressed or anxious, you may notice an increased tension in the muscles. Okay, if the stress or anxiety has been carried for a very long period of time, that stress or tension in the muscle stays for a very long period of time, and it can lead to chronic pain, early fatigue. Okay, such kind of symptoms very common. Okay, so it's very, very important to identify if you are getting stressed on a regular basis and deal with the stress in a correct manner. So good stress management techniques are very, very important. Okay, because if you don't manage your stress, it's going to create some changes in the body, because mind and body are very closely related to each other. I hope you agree with me. Okay, I'll give you a simple example. Okay, whenever we are tensed, there are many a times there are very common areas which are affected. For example, if you see this area of the neck, okay, we tend to get tensed in this particular area of the neck, and our shoulders may rise up. Okay, if the stress is continued for a long time, okay, because of the fatigue of the muscles, the shoulders may get depressed. So such kind of changes are seen within the body whenever the stress is continued for a very long period of time. Okay, now in fibromyalgia, it's not just the pain, the widespread pain in the body. What does widespread pain means? It means that there are a lot of regions of the body which are undergoing pain symptoms. Okay, so for example, the patient may complain of pain in the shoulders, in the arms, in the legs, in the back. Okay, so multiple areas of the body or widespread areas of the body is having pain. So that is one of the classical symptoms that is seen in fibromyalgia. Okay, plus there are some tender spots. So that means that whenever you touch a particular spot, it's very painful. Okay, that's another thing. They become very sensitive to pain stimuli. Okay, so even a small, stimuli can lead to a painful sensation. So their central system starts getting very sensitive to stimuli. Okay, so even a touch can be painful to them. Okay, so that kind of sensitivity is developed within them. Okay, so that's another thing that is very commonly seen. Along with this, there can be some abdominal issues, cognitive issues like brain fogging, so issues related to memory and concentration. Okay, that can also occur. Depression can happen. Okay, so that's why a condition such as fibromyalgia needs a multidisciplinary treatment. So it's not just that you can do away with exercises. You need to also have psychotherapy included when you are managing fibromyalgia. You also need to have some medications included when you are having fibromyalgia. So everything, a multidisciplinary approach is very, very important. Okay, so that's why you need to understand that we need to manage our stress at an early stage so that it does not get converted into such somatic conditions. Okay, so identify what is stressing you out and deal with it correctly. So today we are going to discuss about some of the yoga techniques which are going to actually help in converting your emotions into better emotions. Okay, this is very, very important. Why? Because our emotions are stored within the body. Okay, it is scientifically proven that the emotions are stored within the body. If you are negative, your emotions are going to get stored in your body. If you are positive, the emotions are going to get stored in your body. Okay, I'll give you a simple example. When you are doing something fun loving, do you see the level of energy, the level of flexibility, the level of movement that you are doing? Okay, it is something which is coming out very naturally and very nicely. But when you are stressed, normal movements can also feel painful. Okay, when you are anxious, normal movements can also feel painful. Okay, so today we are going to discuss about those important aspects as to, at a smaller level, how can you convert or incorporate emotions into your asana practice. Okay, it's a classical thing that is practiced at the Yoga Institute. Okay, that is nothing but called as the concept of bhavas. Okay, so today we are going to discuss about bhavas and how to incorporate them so that they make a positive impact on your body. Okay, so over here we practice four kind of bhavas. First one is the dharma bhav. Next one is the Gyan Bhav. The third one is the Vairagya Bhav. And the fourth one is the Aishwarya Bhav. Okay, so we are going to practice certain asanas which are going to incorporate all these four bhavas. And all these four bhavas are going to have a very positive impact on your muscles, on your joints, and on your body overall. Okay, so as to deal with the stress. So let's start with our asana practice. Okay, and I'm going to show you different asanas and what bhavas are associated with it. Okay, so we are going to discuss that. So first, let's start with the conditioning practice, which is related to what is known as the dharma bhav. Okay, what is the dharma bhav? It is the sense of duty. Okay, so what is the sense of duty? Our first duty is towards ourselves. So, taking care of ourselves physically, mentally, emotionally, spiritually, socially, in every way, it is the first duty of us. Okay. So, whenever we are doing conditioning practice or we are starting a yoga practice, we are doing the dharma or duty towards our body. We should have that kind of sense, okay, because we are going to assess our body, we are going to stretch, strengthen our body, we are going to know what is the status of our body whenever we're practicing any kind of yoga asana. Okay, so let's start with Sit Prarthanasana. We are going to keep our legs together, feet together, stand facing at one point, look at one point in front of you. Keep your chin parallel to the ground. Now slowly, you can join your hands in front of your chest. And gradually close your eyes. Now, when you're doing this practice, if you feel that you are unable to balance, you can keep some distance between your feet. Or you can even keep your eyes open, fixed at one point in front of you. But if you are able to maintain the balance with your eyes closed, feet together, it's better to practice it like that. Now, try to focus on your breath and your body. Try to observe how you are feeling in the different areas of the body. Do you feel some kind of pain or tension anywhere? Try to observe how is your balance. Try to observe how is the pressure under your feet. Is it well distributed? Is it more on one feet than the other? Slowly get all your attention towards your breathing. Slowly you can open your eyes and relax. Okay, so this was conditioning, getting all our attention towards our body. Now let's start with warm up. Okay, it's going to give an idea about how is the different areas of the body flexible, tensed, what is the status. Okay, so let's start with the neck first. Keep 1 foot distance between your feet. Let's start with the neck first. So I'm going to take my neck up and down. When I'm doing this, you can try and observe what are the, if there are any areas of pain or stretch. 2, 3, 4, 5, 6, 7. Okay, now we are going to turn our head to either side. So 1, 2, 3, 4, 5, 6, 7. Now slowly bend your neck to either sides. 1, 2, 3, 4, 5, 6, 7. Okay, so these were the neck movements. Suppose if you're not able to get that much of a sense of the movement, okay, if you're not able to judge it properly, you can do it in front of the mirror. That's going to give you a good biofeedback as to how much movement is happening. Okay, next we are going to stretch our shoulders. Keep your hands behind your head and slowly get your elbows in front and take them behind. Stretch and bring them back front. 2 and stretch. Again, front, stretch, 3, front, stretch, 4, stretch, 5, stretch, 6, stretch, 7. All right, now we're going to roll our shoulders. So just take them behind and forward. 1, 2, 3, 4, 5, 6, 7. And the other way around. 1, 2, 3, 4, 5, 6, 7. Okay. Now we are going to rotate our wrists. So you can make a fist and slowly turn your fist around. 1, 2, 3, 4, 5, 6, 7. And other way around. 1, 2, 3, 4, 5, 6, 7. All right, so this was a little bit of warm up for the upper body. Now let's do it for the thorax and the lower body. Okay, so what we are going to do is we are going to turn our thorax. So keep one hand on your shoulder, other hand behind, and turn towards one side. 1. Okay, do it on the other side. Again. 2. 3. 4. 5. 6. 7. All right, so this was rotation. Now let's do hip movements. So what we are going to do is lift the hip straight up from the front. 1, 2, 3, 4, 5, 6, 7. Now we're going to extend the hip from behind. So stand on one leg and lift the hip up. 1, 2, 3, 4, 5, 6, 7. Okay, so now we are going to lift the hip up from the side. 1, 2, 3, 4, 5, 6, 7. Okay, the other side. 1, 2, 3, 4, 5, 6, 7. Okay, now we are going to bend the knee. So just bend. 1, 2. If you're unable to maintain the balance, you can take support of the wall or a chair. 4, 5, 6, 7. If you're unable to hold the ankle, it's absolutely okay. You can simply do the knee movement. 1, 2, 3, 4, 5, 6, 7. Now we are going to rotate our ankles. So stand on one leg and rotate. 1, 2, 3, 4, 5, 6, 7. We'll do it on the other side. 1, 2, 3, 4, 5, 6, 7. All right, so this was a little bit of warm up so that our body is ready for the asanas. All these steps are very, very important. But whenever you're suffering with chronic pain, it's very important to identify your limits. Okay. So whenever you have pain, you're not supposed to cross that limit and still push yourself. Try to respect the limit of pain gradually every day as you are practicing. You can push yourself 5% extra. Okay. So, but really not crossing the pain limit, but going up till that limit and coming back again. You need to be able to identify where your body is feeling sore and painful and respect that. Push the boundaries, okay, slowly and steadily. That's going to be very rewarding for you in the long run. Okay, so now we are going to start with the asana practice. The first asana is talasana. Okay, so what we are going to do is we are going to keep a 1 foot distance between our feet. We are going to practice talasana 3. Okay, now this asana is going to promote the gyan bhav. Okay, as we are getting the information from different areas of our body. Okay, so we are increasing our proprioceptive sense, so the sense of position of the different joints of our body. As we perform the asana, we are going to get an idea of how much is the strength, what position is my different joints in. Okay, and that's going to add on to our knowledge about our own body so that we ourselves can manage it well. Okay, so let's start with talasana. So keep 1 foot distance, keep your hands beside you, slowly inhaling, rise up on your toes and join your hands up. Stay there. 1, 2, 3, 4, 5, 6. Exhale. 1, 2, 3. It's very important to fixate the gaze at one point. If you keep moving your eyes, okay, it's not going to give you that much benefit. Also, you might lose balance. So it's very important that you fix your gaze at one point in front of you. Let's do it again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay. Now, as you're rising up, try to feel how your toes are placed. Are they curling? Okay. Are they remaining straight? From where are you pushing your feet up? Is it from the ball of the foot or is it from some other area? Is your feet turning out, inward? Try to gain as much knowledge about your body as possible as you are performing this asana. Okay. So let's start again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Now, this rhythm of going 1, 2, 3, staying there 6 counts, coming back 1, 2, 3, is also going to help a lot in people with chronic pain or some psychosomatic disorders. Okay, because that rhythm actually eases out the muscle tension quite well. Okay, so let's do it one last time with the rhythm and the breathing. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. All right, so this was Talasana 3. Now let's go on for Konasana 2. So we are going to take about a 2.5 foot distance. If you have had any abdominal surgery, hernia, okay, you're not going to perform this asana. If you have hypertension or any cardiac condition, make sure you're breathing well and only pushing yourself up to your comfort limits. Okay, don't go beyond that. Now, slowly take your hand up from the side, again promoting the Gyan Bhav. Inhaling, bend sideways. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Now in this asana, it's very important to keep the pelvis stable. Okay, so it's not going to move along with you. It has to be stable and at one place. And it's only your upper body that is bending. Let's do it on the other side. Lift your hand up. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay. Very good asana for strengthening your sides. Okay. Let's do it again. Inhale. 1, 2, 3. Stretch your hand. Stay there with normal breathing. 1, 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Let's do it on the other side. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. One last time. Sense where is the stretch in your body, what area is opening up, what is getting stressed. Okay, try to feel that. If there is any painful area, take your hand up. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. It's important to keep your hand beside your ear and try to stretch with the help of your fingers. Okay, so inhale. 1, 2, 3. So I'm stretching with the help of my hand. 1, 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, so mind you, I did not push my pelvis when I was bending this way. Okay, it's very, very important to keep your pelvic stable in this particular asana. Now we are going to go for the next asana, that is Konasana 3. Okay, again taking 2.5 foot distance between your feet. Take your hands in front of you. Inhaling, open your arms up. 1, 2, 3. Now look, turn and look towards your right hand. Exhaling, go down and twist and try to reach the left leg. Now slowly turn your head and look at your upper hand. Stay there. 1, 2, 3, 4, 5, 6. Inhaling, come back. 1, 2, 3. Turn your head towards the other side. Exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. So this rhythm with which we are going, 1, 2, 3, staying there 6 counts, coming back 1, 2, 3, it's going to keep you strain free. Okay, it's going to have more control on your movement. So it is a very effective thing to do, to have counting with each movement that you are doing. Okay, if you have any kind of slip disc, okay, or any spinal surgeries or injuries, you're not supposed to do this asana. Hernia or any abdominal surgery is not supposed to do this particular asana. Okay, now it's very important that when you are doing this asana, you're not shifting your pelvis as you go down. Again, your pelvis is stable and you're trying to control your movement from the thorax, from the hip. Okay, let's do it once again and experience it. Keep your hands in front of you. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay. We repeat this one last time. Increase our Gyan Bhav again. Okay. So take your hands in front of you. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. And exhale. 1, 2, 3. Okay, so this was a rotation asana. Okay, again going to improve your Gyan Bhav. Now let's go for one of the asana which is going to increase the Vairagya Bhav or the sense of surrender. Okay, it's very important to let go of certain things in life. If we keep holding on to each and everything, it's going to create a lot of stress, anxiety, and even depression. So it's very, very important to learn the technique of letting go. And what is a better way to let go? By learning it along with our body. So, as our body is learning the strategy of letting go, our mind is also getting trained to do that. Okay. And that is going to happen with some of the forward bending asanas. Okay. So, we are going to practice Hastapadasana, where we are going to let go or surrender towards gravity. Okay. So, we are going to develop a sense of Vairagya. Okay, so let's start with that. Keep your legs together. Inhaling first, bend backwards. 1, 2, 3. Exhaling, bend forwards completely as much as possible and slowly leave your upper body. Keep your knees straight, hips straight, and stay there. 1, 2, 3, 4, 5, 6. Now slowly raise your head up. Inhale, get your hands towards your ears and exhaling, hands down. All right, so let's do it once again with a sense of surrender. Okay, inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay, so this asana has a lot of benefits for the body as well. Okay, also we are kind of getting the circulation towards our head. Okay, in this particular asana, which is not normally the case. We are always erect. Okay, hardly we bend down forward. Okay, so that the circulation is towards our head. So it's very nice to practice this asana it's going to create a lot of benefits for all the organs that are situated towards our head. Okay, so let's do it once again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay, if you are not used to bending forward, there may be a slight sense of dizziness when you come back up, but it should settle within a few seconds, then it's fine. If you're suffering from any condition like vertigo, okay, you're not supposed to perform this asana as it can be aggravated. Okay, so this was about Hastpadasana, a sense of surrender or Vairagya. We are going to see a few more asanas which are going to increase the Vairagya bhav. Before that, let's see one of the asana of Gyan Bhav again, that is Veerbhadrasana. Okay, so we are going to do Veerbhadrasana too. Take about a 3-foot distance. It's going to create a sense of stability, okay, power. So that's why it's called Veerbhadrasana. Okay, so what we are going to do, turn our foot, right foot towards 90 degrees, keep our hands at the shoulder level. Inhale, exhaling, bend the knee and stay there. 1, 2, 3, 4, 5, 6. Come back. 1, 2, 3. Turn the left foot out. Inhale. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Let's repeat it once again. Take our hands to shoulder level. Inhale. exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Other side. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay, so it's going to create a lot of stability. It's very important when you are doing this asana. I have mentioned it a number of times before as well, that you keep your pelvis aligned on your hips. Okay, shouldn't be backwards or forwards. It's very important that you keep your pelvis aligned on your hips. All right, so these were about some of the standing asanas. Now we are going to see some of the sitting asanas. Okay, again with the Gyan, Vairagya Bhav, okay, and Aishwarya Bhav. Yes, we are going to discuss that as well. So let's sit down, and I think we have a question related to sitting. So good morning, Amitabh ji. Okay, why sitting is in Padmasana and sitting with legs stretched 90 degrees feels strained near the hips and needs support to sit like that? Okay, so there are different possible causes of this. So one of the causes in sitting in Padmasana and feeling the strain at the hip could be a lack of hip flexibility. Okay, so probably you need to make sure that you have got enough flexibility so that you are comfortable in sitting in Padmasana. So probably there are some stretches which make Padmasana easy. You can practice those stretches, okay? Something like taking the leg towards, trying to stretch it towards your body, something like this. Or stretching doing a figure 4 stretch in the lying down position. That's going to actually help in opening your hips up a little bit, okay? That's one of the things. While sitting straight, if you are feeling stress on this area of the hip, okay, a normal stressful sensation is very common because our hip muscles over here are trying to hold us up straight. So this is very common if you're feeling some stress over here. Okay, but if there is a constant feeling of a lot of stress and pain, maybe you need to strengthen your hips and core a little bit. That's going to make things easy. Okay, so that's one thing that you can do. So for strengthening, you can probably practice a straight leg raise like this in the sitting position. Okay, you can practice Naukasana. Okay, so that's going to help in strengthening the core. Okay, you can practice pelvic tilts. You can practice bilateral leg raises. Okay, all this is going to help in creating that kind of strength in the abdominal and thigh area. Another thing that can strain the hip is also the flexibility of the hamstrings. So probably what you need to do is you need to stretch out the hamstrings on a regular basis by performing Paschimottanasana or Hastpadasana, or even for that matter Hastpadangushtasana, where you stretch one hamstring at a time. Okay, so that can also help in releasing the stress or strain near the hips. Okay, so these are the possible things that you can do in order to get it better. These positions, Padmasana or Dandasana. All right, now let's see some of the asanas which are going to again increase the Gyan Bhav, Vairagya Bhav and Aishwarya Bhav. Okay, so first one is the Gyan Bhav. So let's do Parvatasana. Here we can sit in Sukhasana or we can sit in Padmasana. Okay, whatever is comfortable to you, you can choose that. Keep your hands at your side, inhaling. Take your hands up. 1, 2, 3, and stretch up. 1, 2, 3, 4, 5, 6. Exhaling. 1, 2, 3. Once again, inhaling. 1, 2, 3. Stretch. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. It's very normal to feel some stress in the back in this particular asana or around the shoulders. Very common, okay? But you need to make sure that whenever you're doing this asana, you're stretching your hands upwards, trying to straighten your elbows as much as possible, and trying to keep the palms absolutely in contact with each other. Stay there. 1, 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Now we are going to see one Vairagya Bhavasana, that is Yoga Mudra. So again, sitting in Padmasana or Sukhasana, you can clench your hand behind your body. So hold your wrist with the help of the other hand like this. Hold it behind your body. Inhale, exhaling, surrender towards gravity. 1, 2, 3, 4, 5, 6. Inhaling, come back. 1, 2, 3. Exhaling, turn towards one side. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhaling, other side. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Okay. So when you are down, you have to try and surrender towards gravity as much as possible. Try to feel letting go of the body. Okay. That's going to stretch a certain muscles in your hip and your back area, which is going to be very beneficial in the long run. Okay. So now we will practice it once again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. So it's okay if you are not able to go down completely. Just go till where you can go and leave yourself to gravity. Let gravity pull you down. Okay. Don't try to push yourself down. All right. Now let's do it on both the sides. Inhale. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right, so this was about Yog Mudra, again giving you a sense of letting go or surrender. Okay, now let's go on for another asana, which is going to increase the sense of Aishwarya or self confidence and self esteem. Very much required in our day-to-day life. Okay, whenever we are suffering from stress, anxiety, our confidence and our self-esteem is on the lower side, so it's very important to boost it. Okay, and this backward bending asanas are going to actually create a sense of self-confidence and a sense of self-esteem. So we can always practice these backward bending asanas with the Aishwarya Bhav. Okay, so we are going to do Ushtrasana, where we are going to sit in the kneeling position. Okay, now keep your hands behind and slowly try to push your hips up and forward as much as possible. Stay there. 1, 2, 3, 4, 5, 6, and relax. 1, 2, 3. Okay, so this is a backward bending asana. It's going to create a lot of chest opening, spine opening towards the backward side, so spinal extension. Okay, it's going to be very beneficial and creating a sense of self-confidence. Okay, so we do it once again. Keep your hands behind your feet, fingers facing towards you. Inhale and push your hips up and forward. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. And relax. Okay, you can intermittently intersperse this with a forward bending asana so that you have some relaxation in the back. We can do balasana or shashankasana in between. So for shashankasana, keep your knees a little bit apart, feet flat, and slowly slide down forward. Again, letting go. 1, 2, 3, 4, 5, 6. Come back. 1, 2, 3. Okay, we're going to repeat the the Ushtrasan once again. Keep your hands behind. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. And go for Shashankasan. 1, 2, 3. 1, 2, 3, 4, 5, 6. Come back. 1, 2, 3. So it's going to ease out the stress in your back as you intersperse it with one forward bending asana. So these were some of the asanas which are going to improve the different bhavas. Now let's see some lying down asana and a relaxation practice. Okay, so let's lie down by turning on our side. Jagdeep ji, as a rule, is exhaling during bending or stretching and inhaling while straightening back or other way around. So whenever, as a rule, most of the times, whenever you're bending forward, we need to exhale. And whenever you are bending backwards, you need to inhale. Okay, why? Because inhalation is normally accompanied by thoracic extension. So spine extends when you inhale. Okay, and as you bend forward and exhale, the spine also bends forward a little. So that's why bending forward, exhalation, bending backwards, inhalation. Okay, now let's go for some lying down poses. So let's do Setu Bandhasan. Again, a extension pose. So it's going to create a sense of Aishwarya. Inhaling, raise your hips up. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Once again, inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. We are going to do Vakrasana, Supta Vakrasana. So keep your feet together, knees together, hands at 90 degree. Inhale and exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Again, exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. All right. Now we are going to practice one relaxation technique that is known as Shavasana. Okay. So we are going to do a body scan. Try to check what all areas are tensed and try to relax them as much as possible. Okay, but this practice is not supposed to be done by anybody who is suffering from a depression. Okay, otherwise you can practice this technique on a daily basis to release all the tension within your body. It's going to be an amazing practice to do that. Okay, so what we're going to do is keep our legs a little apart, keep our hands a little apart, head straight. If you're wearing any spectacles, you can remove it. Slowly close your eyes. And slowly, we are going to relax one area of the body sequentially. Relax your toes. Feel the tension within your toes and try to relax them as much as possible. Relax your ankles. Take your attention to your ankles and release all the tension in the ankles. Relax your calves. Try to relax the muscles completely, leave it loose, let go. Relax your knees. Relax your thighs. Try to leave them loose and relaxed. Relax your groin. Try to release all the tension from your groin. Relax your abdomen. Let the abdomen feel free with every breath. Try to release the tension from the abdomen. Relax your chest. Relax your back. Feel the different areas of tension and try to release them. Relax them completely. Relax your shoulders. Relax your arms. Relax your forearms. Try to release all the tension from your forearms and hands. Relax your hands completely. Leave them loose. Relax your neck. Try to relax it completely. Let go of all the tension within your neck muscles. Relax your face. Relax your forehead. Try to release any tension within your forehead. Relax your entire body. Try to leave it as loose as possible and surrender it to gravity. Scan the different areas of your body. If you feel tension in any area, try to relax it as much as possible. Slowly move your fingers and toes slightly and turn towards one side into Dridasana. Keeping one hand under your head, knees can be slightly bent. Now slowly take support of your hand and you can sit up slowly. Rub your palms. Keep it on your eyes and slowly open your eyes. Okay, so this is one of the body shavasana practice. Okay, it's going to actually release the tension from the body. It's very good to do it on a daily basis to release the different stressful areas that our body goes through. Okay, so we can do a body scan while we are doing shavasana and try to relax it as much as possible. With this, we come to the task of the week, and that is practicing shavasana. Okay, with this body scan for 15 minutes every day. Okay, you can try and release the different areas of your body. You can click a picture of this, of you practicing shavasana, and uh, upload it on Instagram and tag Times Health Plus. Also, do follow Times Health Plus on their Instagram and YouTube channels for their tips and recommendations. So, this was the strategy or the plan for managing chronic pain or any psychosomatic disorders, okay, that you can practice gradually in on your daily basis. All right, I think we have one question. In Balasan, either my tummy doesn't touch the thighs or the hips don't touch the back of the heels. Are all supposed to touch down and forehead should also touch the floor at the same time? Jagdeep ji, it's absolutely okay if it is not touching, but gradually you can try and practice that your hips are on the heels and then gradually you're trying to bend forward and trying to touch the head on the ground. But do not try to force yourself. It's absolutely okay because maybe there may be some slight stiffness in the back which may take some time, or in the hips which may take some time to get released. It's absolutely okay to go slow and steady and respect your body limits and gradually reach to the goal of, touching your head to the ground. That's absolutely fine. All right. So this was it for today. I hope to see you next time with some other condition and some more knowledge on different aspects of those condition and asanas. Till then, stay present, move gently, and make sure you take care of yourself. Thank you and namaste.